Hey, how's it going? I'd like to take a moment to just kind of explain some things to patients because sometimes we as doctors and providers, we use a lot of different words that kind of confuse people. And so a lot of people think of, I got allergies, I get shots, but this isn't necessarily kind of the only option for people. There are a lot of different ways to provide immunotherapy. So it's really important to understand what is immunotherapy. To kind of put it simply, immunotherapy is basically retraining your immune system. You're basically saying, hey, these are the things you're very reactive to. These are the things that make you sneeze, makes your nose congested, sometimes gives you wheezing or watery eyes. And we take these allergens that you react to, and we basically give you a concentrated dose of these allergens in regular intervals. So we allow your body to build immune memory. And so by doing this training or retraining, we teach our body that these allergens aren't something dangerous. They're not something you need to react to. And they're something that over time, your body starts to ignore. And that's the beauty of allergy immunotherapy, is we retrain the body to ignore these innocuous allergens and not to respond to them. And that's what provides the symptom relief. Breathing better, less mucus production, less drainage, less skin changes like eczema, and decreased rates of asthma. So now that we understand what immunotherapy is, it's important to understand what your options are. So historically, the bread and butter of most immunotherapy has been providing allergy shots. And so what shots are, we basically take the things you're allergic to, we dilute it down to a safe amount to inject into your skin. We do that weekly at first as we're increasing the dose until we get to a point of what's called concentrate. And that's the highest applicable dose that can help in your treatment. Once we get there, we start to space it out. We go from weekly to bi-weekly, eventually to monthly. And this process, we have to go slow. We have to make sure it's safe, that there's no risk of things like anaphylaxis or large local reactions. Once we know it's safe, we usually continue that therapy for several years. And then we retest patients to ensure that they are improved relative to when they started their allergy shots. All my patients ask me all the time, what is allergy testing? What are we actually going to do there? There's a lot of misconceptions. All my patients think we're getting needles, we're getting injections. And I figured, as someone who suffers from a little bit of a dust allergy, who's always been curious about if he's allergic to some molds and things like that when he's in basements, why don't we go get allergy testing ourselves? So come with me as we go to our allergy nurse and we try a little bit of testing ourselves. Come on. Welcome to the allergy testing room. This is Jada. She's our nurse. She's going to be taking the first well, which has kind of the most common allergens that we're using. Our first one's going to be a bunch of different trees, different grass mixtures. Some of the other ones that we have here have to do with things like weeds, things like dust, and as well as animal dander. And so these are going to be the different wells. And so as you can see, we'll show you kind of what these kind of applicators look like. And this is what we use to do what's the skin prick testing. And as you can see, there's no syringes, there's no large needles. All it is a tiny prick. This is going to take up the allergen and it's going to go right onto my skin. Would you demonstrate to them how that goes? So we always wipe it with alcohol, clean up the area, and we basically take the device and we essentially just place it right there on the skin. It doesn't hurt. It's just as if someone just took their fingernails and gently applied it to your skin. What that does, the allergen gets in there, your immune system, which the cells in the skin will take up that allergen and start to demonstrate a reaction. And so we look for something called a wheal, which is like a little circular reaction to the allergen, and we basically measure it. And that's how we know whether you're positive or negative to that allergen. And that's how we tailor your treatment, all right? Now, another really interesting, innovative, and new way we provide immunotherapy is we use the sublingual route underneath the tongue. Why is this relevant? Why is this important? Well, underneath the tongue, you don't have the same type of immune cells as you have in the skin. We all know we can get hives, we can get eczema, we can get urticaria, we can get all these changes in the skin because the skin has a lot of these allergy type releasing cells. Underneath the tongue, however, there's a lot fewer of these types of cells. Now, because the tongue is less reactive, we are able to deliver a much more concentrated dose underneath the tongue. And because it's so safe, we don't have to monitor you in the office for 20 or 30 minutes after the delivery of the immunotherapy. You're able to do it in the convenience of your home. And because we're able to do it at home, we can actually give the dose more frequently. We can give it to you daily. So now we can give you a more concentrated dose at a higher frequency and a more convenient package. This is an incredible option option for patients who maybe live a little too far away from the office. Maybe their work hours don't allow the flexibility for them to come in for a shot. Maybe they're away at school, they're in university, they're a college kid, and they can't get in regularly. Maybe they're too reactive to shots and they can never get ahead in their immunotherapy via injection because they have too many reactions. So this provides a really excellent option for patients to get a little bit more of the allergy immune response, to do it a little bit faster, and to be doing it essentially in a safer way.